MD Anderson Cancer Center at Cooper is the only radiation oncology center in the region that has access to MR-guided radiation therapy. MRI has an ability to distinguish between cancer and the normal organs that live around that cancer in a way that no other imaging technology has. When you combine that method of imaging with the delivery of radiation therapy, and you're doing it at the same time, you are able to precisely target the cancer as you're delivering the therapy using that high level of imaging in ways that have never been done before. What's special about the MR guided radiation therapy is that it is actually 21st century technology. Welcome to the MR guided radiation therapy facility at MD Anderson Cancer Center at Cooper. I am Anthony Dragun, and this is our lovely and talented staff, Jess, Miranda, Andrew, and then we have Tanya, our volunteer today. So most people are familiar with MRI in terms of diagnostic radiology, but it wasn't until basically 10 years ago that this technology was developed to actually use an MRI as we're delivering cancer treatment. We can actually use this platform to actually do the MRI while we're treating the patient's cancer.
All right, enter there. Okay, Jess is right behind you. All right, so right in here. Oh wow.
So we've already went through all our screening questions, so you're safe to come into the room.
Okay.
So right in here, you can come on in. You're going to be lying on your back on the table right here.
So, what they're doing right now is, and it is fairly loud in there, the magnet sort of makes noises, and people are generally familiar with that if they've had an MRI before. But what Miranda and Jess are doing is every single patient who we're treating, depending on the cancer that they have, has some type of immobilization device to keep them steady during treatment and to keep them comfortable during treatment. And then there are some enhancement pieces of equipment that help us to focus in on the part of the body that we're interested in treating. Yeah, so while they're finishing up with Tanya and getting her positioned properly, I'll show you what Andrew and I do at the console. Okay. And then Andrew and I typically will work here at the console together. Medical physicists and radiation oncology physicians work together all the time to design and optimize plans for patients. But this is an opportunity. What's really different about this technology is that we're working together in real time as the patient is being treated on the table. A lot of times, radiation planning and delivery is separated in time and space. That's kind of like what I consider 20th century technology. You are planning the patient one day, designing their treatments on other days, and then delivering the treatment on another day. This, we're doing it all at the same time, all in real time. We are using basically the MR to define where the patient's tumor was. And you can see kind of a different kind of digital readout over here. And then these are the real-time images that we're seeing as the patient's being treated.
The big jump is that we are now able to properly model how radiation is affected by the magnet of the MRI, which is something we haven't been able to do up until a few years ago. What this screen is showing us is the amount of dose distributed across the target that our doctor has requested us to be able to deliver to the patient. And we can do this on a very granular level. So every time the patient's being treated, we are doing a full model of exactly what's happening to them in more or less real time. We can see what the effect of that radiation would be on the patient's body by looking at how much radiation is sort of being deposited in each of these either organs or the target itself. And we're using that powerful MRI technology to be able to figure out to a very, very high degree of precision where the patient is every day.
Yeah, and their anatomy is going to change every single day. Every single time you are getting up in the morning, every single time you're walking down the street, your body is functioning in ways that you don't see. You're breathing, okay? The chest is moving up and down, it's moving the internal organs. All that stuff is happening out of anybody's line of sight, but not out of the MRI's line of sight. The MRI sees everything. It sees the differences, the small differences in the amount of bloating that might be in the stomach, all those things can impact where your tumor is located. And if you can't see it, you can't treat it. The other thing that happens over the course of somebody's treatment is that the tumor, hopefully, depending on the type of tumor it is, but what we hope and what we anticipate is that with chemotherapy sometimes and with radiation a lot of times, the tumor gets smaller as you're treating it. And so you can adjust your plan if the patient comes in the next day and their tumor is much smaller than it was the first day, you're not still sort of obligated to treat the initial plan, which is what you have to do with older technology. And with common technology, you have to treat the initial plan. Here, you make a whole new plan on that particular day that's going to take into account all the anatomy that's going on, the changes in the tumor, the changes inside the patient that you cannot see with any other technology.
You can scroll through this dose that's being delivered to the patient in 3 different dimensions. And it gives you a very dynamic and day-to-day look.
When you can see something in real time that you're interested in, it's better than trying to hit something blind based on coordinates or instruments or something like that. So I think what makes people sort of confident in this is that you're seeing exactly what you want to see in that patient's body, not in some sort of generalized model, not in the scan that they had 2, 3, 4 weeks ago, 2 months ago, when they were first diagnosed, but actually in real time. That's the miracle of this machine, to be honest with you.
Behind all the walls in there, there's a big ring that is able to emit radiation, and we shape the beam at each angle that it's delivering to the patient in a way that lets us very precisely target the shapes that we sort of define on the daily MRI. The big advancement that they figured out how to do was more in terms of the digital end of modeling what happens when you expose radiation to a very powerful magnet. We didn't really have the computer strength to be able to do that until very recently. So this computer system that we have here is doing a very advanced modeling method, which is part of what my job is to make sure it's doing that correctly.
This is just brand new technology. So we have some restrictions on like the size of the tumor or the area that we want to treat that probably will expand over time. But for right now, we're generally saying that this is best suited for patients with small localized tumors or areas of the body that you want to treat and target the radiation to that are next to vital structures, in the abdomen, in the pelvis, in the central nervous system, breast tissue. We're one of the only centers in the United States that actually hosts people here for educational purposes.
Where's Tanya now? Is she still in there?
Yeah, she's in there.
Let's get her out and ask her if she's comfortable.
Okay, all right.
You can ask her on the intercom.
Yeah.
Yeah, we
Go
did.
ahead, get the mic in.
All
You
right.
gotta get the mic in.
Tanya, are you doing okay?
Yeah, oh, sorry. Can you hear me?
Yep, I can hear you.
Oh, cool. Yeah, I'm good, thanks.
Great, you're almost done.
Huh? What was it like?
It was cool.
Yeah.
It was actually very relaxing. And the blanket was nice and warm.
Yeah. Yeah, we spend most of the time out here warming blankets.
And if she was actually being treated, would she actually feel any different? She would feel the same.
It's the same way. We actually did treat you, so.
So I feel so good right now.